Hi friends, I am Dr. S.K. Bansal, consultant neurosurgeon at Neurocity Hospital, Ludhiana. Today, I will briefly discuss about an important health problem, that is stroke. Stroke, as you all know, is also called as brain attack. Stroke is a very important cause of mortality and morbidity worldwide. Stroke can be of two types. One is of ischemic stroke and another one category is hemorrhagic stroke. Ischemic stroke results from reduction of blood supply in the blood vessels supplying the brain. There can be complete or partial reduction in the blood supply. Hemorrhagic stroke results from rupture of blood vessels of the brain inside the brain. Ischemic stroke is far more common than hemorrhagic stroke and it is seen in approximately 85% of the cases. Brain requires oxygen and glucose for its energy needs, and when the blood supply to it is reduced, then brain will not get the required oxygen and glucose, and within a few minutes brain cells starts to die. This blockage can be because of direct clots formation inside the vessels of the brain, or sometimes the clot formation occurs much proximal to the brain vessels, like in the neck vessels or in the heart, and some part of the clot breaks off and travels to the brain vessels and occlude them, resulting into the loss of blood supply, resulting into a stroke. In hemorrhagic strokes, as we discussed earlier, that it results from the rupture of blood vessels, the main cause for which is hypertension. However, in some cases, the brain vessels walls becomes weak and they dilate like aneurysms or AV malformation, which ruptures and results into the brain hemorrhage. Stroke is largely preventable, and approximately 80% of the cases of stroke can be prevented. As there are so many risk factors associated with stroke, if we manage them and modify them, the rate of stroke can be reduced substantially, or the strokes can be prevented. The majority important risk factors in stroke are high blood pressure or hypertension, high cholesterol, diabetes, smoking, then certain heart diseases, as well as overweight and obesity, and lack of exercise. So if we manage these factors like quitting smoking if that is there, controlling the blood pressure and diabetes, reducing the weight, and doing regular exercises can reduce the risk of stroke substantially. If somebody is having heart disease which can cause stroke, they need to be managed properly to reduce the rate of stroke. Now, if somebody has a stroke, it needs to be identified so that a proper treatment can be instituted. Stroke signs and symptoms particularly mainly results into weakness of any arm or leg or one side or the side of face. Similarly, there can be numbness in arm, leg or side of the face. There can be changes in the speech like inability to speak or understand. There can be changes in the vision, and apart from these, there are many other factors, many other signs and symptoms which can be there in cases of stroke. To identify that somebody has a stroke, we need to know about the sign and symptoms or presentation of it so that we can identify it, and then only we can institute the proper treatment. The important signs and symptoms of stroke are weakness in arm, leg or side of the face. Similarly, there can be numbness in the arm, leg or side of the face. There can be changes in the speech, and there can be changes in the vision. There can be altered sensorium or loss of consciousness. Stroke is a medical emergency and all patients needs to be hospitalized as early as possible. This is very important because nowadays in many cases certain treatments are available which, if instituted within a limited window period, can make complete recovery, and the difference can be significant disability and complete recovery. For example, there is a treatment called thrombolysis. In selected cases, if it is instituted within 3 hours, it can make significant difference in the mortality and morbidity. Similarly, in some cases of hemorrhagic stroke, where the mass effect or intracranial pressure is very high, sometimes surgical intervention is required. In many cases of stroke, having rupture of aneurysm, surgical treatment will often be required. Despite all the treatments, or I say lack of treatment, many patients with a stroke are left with significant morbidity, and for them it is multi-modality approach is required for their rehabilitation, like physiotherapy, speech therapy, occupational therapy, and behavioral therapy. Thanks.